At what stage of Parkinson's disease does dementia occur? Have you ever wondered when dementia shows up in Parkinson's disease? This is an important question for many. Dementia related to Parkinson's disease, often referred to as Parkinson's disease dementia, usually develops in the later stages of the condition. Initially, Parkinson's disease presents with motor symptoms like tremors, rigidity, and slowness of movement. However, as the disease progresses, non-motor symptoms, including cognitive decline, become more noticeable. Research indicates that around 30% of individuals with Parkinson's will eventually experience dementia. The risk of developing dementia increases significantly for those who have lived with Parkinson's for many years and for older patients. Interestingly, dementia is more common in those with severe forms of Parkinson's disease and less likely in patients whose symptoms are primarily tremor-dominant. Typically, the onset of dementia occurs after several years of living with Parkinson's disease. It often appears in the intermediate to advanced stages of the disease progression. When dementia develops, it involves a decline in cognitive functions such as memory, thinking, language, planning, behavior, and judgment. Over time, this cognitive decline can worsen, leading to a reduced quality of life, increased mortality, and a greater likelihood of requiring nursing home care. The progression to dementia can vary significantly among individuals. Factors such as the subtype of Parkinson's disease and the patient's age can influence this progression. While motor symptoms may be the first to appear, cognitive symptoms often emerge later, sometimes many years after the initial diagnosis. This reflects the underlying neurodegenerative process that affects multiple regions of the brain, not just those controlling movement. In summary, dementia in Parkinson's disease generally occurs in the later stages, often after several years of disease progression. It is more prevalent in older patients and those with more severe forms of the disease. This represents a significant non-motor complication that impacts both the patient and caregiver's quality of life. Comprehensive management is essential to address both motor and cognitive symptoms. Always consult healthcare professionals for personalized advice and treatment options.